Described for us today. Prior to UW, he was at University of Arizona for 3 odd years or so, and then got his graduate degrees both at Yale and Michigan. So very happy to have you here. Thank you. If there's more you want to describe about yourself, I'll let you do that. So thank you.
Thanks, Paul. And thanks everyone for coming out for the talk or for the cookies. You don't have to tell me which it is. But happy to share some work with you today that is really a collaboration between myself and a number of climate epidemiologists or public health researchers. As Paul said, I'm a geographer by training, and so public health is a little bit new of a research area for me. But I've found some of this collaboration really exciting and interesting. So, as I said, the topic is in part public health, but also on flooding. A lot of research that I do is how do we observe flooding using satellite imagery. But before I get too far down the rabbit hole, just a little bit more about myself in case there's other interests in the room. Much of what I'll be talking about today is climate hazards and flooding, which is part of the research I do. I do other work on land rights and development, much of that in sub-Saharan Africa, Zambia, Tanzania, and Ethiopia. What sort of ties all of that work together is inequality. I try to look at a lot of this work through the lens of inequality, disproportionate impacts, and these are a few of the research themes. So if you want to talk about agriculture, land rights, development in places like sub-Saharan Africa, I'm also really happy to connect on that. But for today, we'll talk a little bit of just the state of estimating health outcomes from climate extremes, some of the high-level sort of conversations and debates there, a review that we did on health studies in the U.S. to kind of contextualize what's the state of things at the moment as it relates to flooding and health outcomes. A little bit on how can we improve flood exposure using satellite imagery, and then from there, how do we use those data sets to ask public health research questions related to the rates of mortality in the United States, the rates of morbidity or hospitalization in the United States, and now some improvements that we're making with AI models to flood exposure and why that's meaningful to also our research on public health. So to start, it's really important to think about the public health impacts of climate in general as long-lasting, wide, and often made up of components of direct and indirect effects. I think often when we think of the climate effects on health, on things like mortality, right, we think of direct causes. So in the case of flooding, that might be a drowning, for example, being hit by debris, okay? And those tend to be the most commonly reported in terms of government statistics, publications, but there's much wider effects to climate. Okay? So from this paper, they sort of thought about the wide effects of climate change as cascading hazards, so impacts on the electrical grid, malnutrition, infrastructure, road networks, what have you. And then of course we could think about compounding hazards, so not just flooding, but extreme heat following flooding, leading to a wide array of problems that really challenge health and health outcomes. In the space of flooding, we anticipate that lots of these impacts can affect different types of disease, waterborne disease, respiratory illnesses, pregnancy complications, malnutrition, mental health, right? And so there's really sort of a wide variety of health impacts that can have to arise from climate events. So to get away from being quite so abstract and be a little more specific, we can think about Hurricane Maria in Puerto Rico, which happened in August 2017. And after Hurricane Maria, parts of Puerto Rico did not have electricity for 180 days. The long-lasting effects of this climate event were almost 6 months long. Okay? So before Maria, here's a map of the illumination of Aguas, Puerto Rico, a city in Puerto Rico. Right? 8 days after the event, there's no electricity in that city. 2 weeks after, you can start to see some lights coming back on. And if you look at that city over the course of 6 months, right, it took almost that entire time to get back to full electrification. Okay. And so if we just take this as an example, right, not having electricity for that extent of time, right, can really challenge health systems, hospitals, anyone that has a medical device that needs electricity or battery power operated. Those are things that are going to sort of lead to changes in health outcomes as we see it. And this really sort of came to a head in almost a political debate over what really was the mortality rate following Hurricane Maria in Puerto Rico. So the official estimates originally came out that there were 64 people who passed away as a result of Hurricane Maria. But several academic groups did studies and they found that it was actually more, according to their estimates, closer to 4,600. And as of today, we have estimates that range anywhere from 800 to 5,000 in terms of mortality after Hurricane Maria. And part of the discrepancies described here in this New York Times article, where how we account for death and mortality following events, are that doctors follow conventions that consider the disaster a factor only if it directly contributed to a death. For example, through structural collapse, falling debris, floods, drownings. So that's the way that we typically account for health outcomes following a climate disaster. And so, in part, this led to a National Academy panel who came out with a report on assessing the direct versus indirect effects of mortality, morbidity, and public health outcomes. And really stating that we should consider both individual counts, such as the example that I gave you, as well as population estimates should be considered, and how we report mortality, morbidity, following flooding, following a hurricane, following a tropical cyclone. And so, just a little more detail on what we mean by a population estimate. This is very similar to the concept of excess deaths. Maybe you've, during the pandemic, you've looked at a lot of these graphs, so maybe they're a little more familiar than they used to be. But here, for example, we can look at sort of the rates of mortality that just exist in Puerto Rico in a normal time in a normal year. So 2015 and 2016 in gray. But then in 2017, as a result of Hurricane Maria, we see that rate of mortality really change. Okay? And so really accounting for this difference is what we mean by a population estimate as opposed to a direct account. Okay? And here on the left, we can see that rate per day over the course of a year. Here, the cumulative is just an interpretation of this graph on the left in terms of a cumulative amount of deaths that occurred following Hurricane Maria. And this becomes really important in how we account for mortality following climate events. So there's really a bombshell paper that came out from Rachel Young and Sullivan saying, I think Joel used to work with Sullivan. So if you want more details of that paper, Joel might know about it. But this is a really stunning paper that tracked tropical cyclones since the 1950s and looked at their relation to mortality decades out. And on the bottom here, we can see what are the sort of the direct counts of mortality or deaths as a result of these different tropical cyclones that have passed through the U.S. Okay. Every decade is colored a different color. Right? And we can see that the mortality effects, at least from this paper, are incredibly long-lasting years. And if you take the average mortality rate as a result of a tropical cyclone from a count estimate, right, that comes out to be 24. Whereas if we use this paper for that estimate, it's somewhere around 7,000 to 11,000. Okay? So we're off potentially by 2 orders of magnitude when we think about the toll of a tropical cyclone and perhaps flooding. Okay. So that's some of the details of how do we account for the toll of climate events. Why is that really important? One of the main ways that we think about vulnerability and adaptation to climate is using measures and estimates of mortality. So this is a paper from Brendan Youngman, who's a hydrologist at the World Bank. He wrote this paper back in 2015, looking at the fatalities in different distributions of income for different countries, and concluding that mortality rates are decreasing over time following flooding. The title of the paper is Declining Vulnerability to River Floods. We're becoming less vulnerable to flooding over time, shown by this metric of mortality. And I look at this graph and I wonder if we use a different way of estimating mortality, for example, what's this number going to really look like? What's this trend really going to look like? Okay. So part of the work that I've been doing the last few years is trying to develop meaningful methodologies where we can estimate mortality following flooding, getting at some of the indirect causes. So where we started is just looking at a review of health studies and flooding in the United States, and found some really, I think, important limitations in that space. So first off, there's really low coverage of how we look, where we've looked at flooding in health outcomes in the United States. So anywhere in this map on red is where a study has covered a county, looking at the mortality or different health outcomes as a result of flooding. What's in the background are the rates of floods and tropical cyclones that we see in the United States by count. Okay? So we obviously see lots of that in the Mid-Atlantic, the Midwest, but not necessarily great coverage in terms of health studies in those areas that are frequently flooding. And another thing that came out was that about 70% of the studies don't use any baseline data. What we mean by that is they don't use any data on health outcomes prior to an event. Okay, so disease rates are low or high in a particular time or a particular place. They don't account for that in their study. And they don't use any methods that would sort of serve as a proxy for baseline. Okay, they don't use any methods where maybe they take a county that has a certain prevalence of cardiovascular disease and compare it to another county that has the same rate of cardiovascular disease, one of which experienced a flood, another that didn't, and compare those. Okay? So almost 3/4 of the studies in this space aren't really using statistical methods that can help us draw out causal inferences from it. Another really important finding from this review was that we really only look at major flood events, okay? when we do studies on health outcomes. So from the $1 billion disaster data set that we have here in the United States, you can see that some of the biggest disasters in terms of cost were included in our review, here in blue, where lots of other disasters in red were not covered in our review. We didn't find any articles that covered those storms. Right, and these tend to be storms that are really profound in terms of the human toll, in terms of mortality. Okay? So on this graph here is mortality. So from this review, we essentially find, okay, we're not using appropriate methods to sort of account for different explanations of mortality rates. We're really looking in only certain areas of the United States, and we're really only focused on some of the biggest storms that have occurred here in the United States. And I would say one of the biggest reasons that we see some of those trends in this literature, that it's really difficult to say where it has flooded in the past. It's really difficult to get information and data on where flooding has happened, who has actually experienced flood exposure, the intensity of that flood exposure. And so one way that some of the work that I'm doing to try and improve that is using data from satellites. So if we just think about some of the typical data that we have sort of in the flood disaster management cycle, so this is a common cycle that people think about in terms of a flood happening, response, recovery, mitigation, and preparedness for the next flood. One of the very common data sets that we have that are incredibly useful are hydrological or hydraulic models of flood risk. And what these models tend to really exemplify and give us information on are the probability that a place will experience a flood in any given year. Okay. Super useful for understanding where to put in mitigation, super useful for preparedness, less useful for understanding what has happened after a flood has actually occurred. Yes, you can use these models to create exposure maps. That's less commonly done. And then on the side of what is happening in response to flooding, or how long is it taking certain communities or people to recover, what the literature tends to look like is a real big smattering of kind of inventive ways to get at exposure. Okay? Lieberman and Cribben, they went out and did surveys of households in New York City after Sandy to try to understand who's experienced the flood. Curtis, in 2011, they used emergency 911 calls to locate where people were calling in for help related to flooding. Beth Tellman used something called the Storm Events Database from NOAA. That tells you if it flooded or not in your county. So you would know Dane County flooded today or not. It wouldn't be very specific to specific location, and it's pretty coarse information. So this is kind of the space of what does it mean to, how can we get exposure data for flooding in the past. I think there's a really big opportunity to use satellite data to get finer and finer information on flood exposure. So here's a map of flooding where you can see the water. There's sort of turbid water here, filled with lots of soil and sediment, in brown where it's flooding in this particular image. Okay. Satellite imagery is increasing in its frequency, in its spatial resolution, and in its availability. And it's a really powerful resource where we can start to understand historical flood exposure and start to draw out some of the public health implications. So this is a paper that I worked on with Beth Tellman, who's a spouse and colleague in that order, also here at the University of Wisconsin. And we published a global flood database that covers 2000 to 2018 and maps nearly 1,000 different floods across the globe in that time. And some information and data that you can get out of that is the flood extent. So this is an example of Bangladesh in light blue. You can see all the areas that are flooded. Here also is Hurricane Katrina in New Orleans. In light blue, you can see the areas that are flooded. You have to squint, but this is actually the 9th ward right here in New Orleans. We can also capture duration, so how long the flood has occurred, since we have images every day. And so this put together the first observational database of floods for the globe using satellite data. And as I said, we can provide estimates of inundated area, population exposed. And a real big insight from this paper was that the rate of population change or population growth was 20% higher in flood zones than in non-flood zones. So in a very meaningful way, we're actually building into greater risk and flood exposure over time. So this is one way, and I think a really exciting and compelling way that we can sort of resolve some of those, some ways that we measure flood exposure. Okay. So then we can actually use this data to directly ask some public health research questions, okay? And to sort of get at what are some of the indirect impacts of flooding in terms of mortality and morbidity here in the United States. Just checking the time. So I worked with two groups, some public health researchers at Columbia on a case study of mortality in the United States, and then other public health researchers at Harvard looking at hospitalization rates. I'm really interested in how do floods affect cause-specific death rates, so not just total mortality, but we can look at very specific causes, cardiovascular disease, respiratory illness, okay? And the same for hospitalization rates. And in particular on the mortality study, we had different types of floods, different causes of floods, breaches of dams, heavy rain. Do we see different associations in terms of mortality as a result of those different causes of floods? Okay. So the way that this works is we took the global flood database. Right? We could, for every county in the United States, could count up the number of floods that occurred in that county. We also drew out exposed population in all of those counties that sort of overlaid areas that we identified as flooding. And then what we can do for a given time or year is pull out a specific flood event. So this is Hurricane Florence that hit the Carolinas in 2018. We can say that these counties in these months were exposed to flooding. And from there, we can match all of the, we can match public health data from these counties that represent death records from the National Center for Health Statistics. So every month, we have panel data that represents mortality or death rates in that county. Okay. And then from there, we can put that all together in a statistical model. The public health researchers I work with love to use Bayesian statistics, which isn't my forte, but they use something called a quasi-Poisson model to look at the association of monthly death rates and flood exposure. And importantly, we match on a county and month of every year and really are looking at the contrasts within month and We also use lag terms, so we can look at what are the mortality rates months after a flood event. Okay. And then we also break out storm severity depending on the amount of exposed population. Okay, so we can look at severe floods versus more mild floods that are exposing high proportions of populations in the county, as well as flood costs. So we can sort of stratify our results across all those dimensions. And then we adjust for some other climate variables and longer-term trends. If none of that made sense, that's okay, because I have this slide to maybe explain it a little bit more. If a quasi-Poisson model doesn't mean anything to you, basically what we're doing is we're taking all the counties that were exposed here, for example, Hurricane Florence, and we're putting in a term in our regression model that accounts for the variation across counties. So maybe some of these counties have different mortality rates due to different types of diseases, cardiovascular disease, what have you, different flood risk. Right? We account for that by putting in a fixed effect for counties. And then we address sort of variation across months by doing the same thing, by only looking in, for example, the mortality rates for September. Okay? And we do that for September 2018, September 2017, September 2016, September 2015. We're always comparing September to September, past Septembers, to see how the mortality rate has changed. Okay. And so this is what the mortality records look like, just at a very high level, descriptive sense of mortality rates in the US by different diseases or different causes of death. So we had information on cancers, cardiovascular disease, injuries, infectious disease, respiratory disease. And you can see in some of these causes of death, right, there's seasonality to it. So another reason that we really want to compare within month for every county. Okay. And then we also had information on different causes of those flood events. So was this driven by heavy rain or a tropical cyclone? Snowmelt is a common occurrence of flooding, especially here in the upper Midwest. And dam break floods as well. Okay, so we can break out our analysis and make different estimates for all these types of different floods in the United States. And what we found was, I think, really striking in that snowmelt is actually one of the highest causes of mortality in terms of flooding. So if we look at the snowmelt flood here, we can see in the month that it actually flooded, the mortality rates in those counties are rise about 5%. Okay. For other types of flooding, so heavy rain, we often see for the most severe events, so severe, very severe being in dark blue here, for those events we do see excess mortality, and in some cases we see those mortality rates still elevated several months after a flood. Okay. Why snowmelt? If you go back to this map here, we have a lot of the snowmelt events here in the Dakotas, Minnesota, and that actually happens to track with some of the highest proportions in the U.S. of elderly populations, so populations over 65. So it turns out that that's a really vulnerable community in terms of exposure to floods. And in a second, we'll see some of the types of causes of death that are driving that might sort of pull that puzzle apart a little bit. So like I said, we could stratify all the results across different causes of floods and different causes of death. And I think the results speak for themselves. That's a joke. Let's like zoom in on a couple examples. So here we're looking at infectious disease for snowmelt floods and for heavy rain floods. And we can see that infectious disease, at least in the case of very severe flooding, we do see elevated cases of that. Okay? And it does, but really only in the case of very severe floods. All right, this is something that we expect. We know that waterborne illnesses, for example, are moved around during floodwaters. Right? You can dry out sewage. It can create all sorts of infectious disease that you can be exposed to as a result through flood water. If we look more specifically at snow melt, so here this is just results for snow melt floods, for injuries, neuropsychiatric conditions and respiratory disease, we really see a high spike in response in respiratory disease. Okay? So remember, this is happening in the Dakotas, right, where there's really high proportions of elderly population by virtue of it being snow melt, it's cold, it's winter season. Okay? Respiratory diseases are at a higher rate. And so we're actually seeing a high vulnerability and a high death rate as a result of this type of flood, snowmelt floods, and that's located in that particular portion of the United States. That's a really interesting result. If we go all the way back to, we used to just, in previous studies, we only really look at the Hurricane Katrina's of events in terms of flooding and mortality or other public health outcomes. Right? Really hidden in that is, right, this really big driver of mortality that's happening that I frankly have not seen a lot of papers on mortality and flooding in the Midwest as a result of respiratory disease. Yeah.
Out of all those events, it's the most predictable too in terms of time to react and get people out, but it's the age population of moving people out of the way. Because snowmelt evolves, takes a while to occur versus a rapid thunderstorm development and a flash flood, for instance, right? So there's time to figure out the problem, but it's moving the people and it's due to the elderly population.
Yeah.
Makes sense.
Yeah. That's a great thought. Now I've lost my train of thought, but I agree with you. So on to the some other studies that we did. So we also looked at hospitalization rates in the United States. We did this by using Medicare or Medicaid data. So by virtue of using that information, we're looking at a population of people that are 65 years or older. Okay? So we're already looking at an elderly population. We tend to say that it's a vulnerable population to climate outcomes. We actually have this data at a zip code level, so we can actually even look at hospitalization rates at a much sort of finer administrative level. There's many zip codes within counties. And we did a very similar sort of statistical design as the one before. So we're stratifying by county. This is actually weekly information, so we're stratifying by week and comparing similar weeks from prior years. Okay. And again, we have outcomes on cause of hospitalization across a sort of wide array of health issues, infectious disease, etc. I'm not going to go over all of these graphs, but if we look at, for example, injury. So injury we can see is interestingly really elevated in the first week of flooding. So here in red and blue distinguish severe floods versus sort of mild, I'll call them mild or moderate severity floods. Right, and then that sort of signal disappears, and then it comes back a few weeks later. In these results, I find the interpretation the most interesting part and the most challenging part. Our explanation is that this is the results, sort of maybe our estimate of direct causes of flooding and hospitalization, whereas here, maybe in recovery efforts, several weeks after, there's sort of elevated injury rates as a result of that. And back to respiratory disease, interestingly, so remember this is spread out across weeks instead of months. So in the first few weeks, we actually don't see elevated rates of respiratory disease, but in the fourth week, that's when we start to see really high rates of hospitalization. Why in the fourth week? It could be because hospitals are difficult to access. It could be because it takes a while for respiratory disease to sort of circulate and elevate. Lots of reasons that could be happening, but we don't really see this issue coming out for at least a month or so. And so if you're just looking at the direct causes of hospitalization or direct causes of mortality, you really focus on the first few weeks, and you're going to entirely kind of miss this result that's coming out several weeks afterwards. So there's a story in every little graph here. I'm not going to go through all of it, but really would like to transition to what are we doing to improve some of the measures of flood exposure using deep learning or machine learning methods. And I'll talk a little bit about why I think that's helpful and important to some of the research we do on public health. So here is a flood model that was designed, a flood exposure model that was designed for Bangladesh. using a satellite that spans from 2000 to 2020. And we used a deep learning model to construct this. In short, the global flood database that I showed before has a number of limitations. Okay? It's an optical satellite, which means it sees the same wavelengths that you and I do. And so one of the hardest parts of mapping floods is that there's lots of clouds. And this satellite in particular can't see through clouds. The innovation that happened in this study was we used a satellite called Sentinel-1 that's based off radar imagery. What does radar imagery look like? It kind of looks like this, black and white. And it has this interesting little superpower where it can see through clouds. Okay? And we matched, we derived flood maps from Sentinel-1, and then we used those flood maps to then train a model on Lotus. And importantly, we used temporal information from Sentinel-1 data, which is captured in a deep learning model here called an LSTM, or a long short-term memory model that accounts for temporal information. And then the spatial information in those images was captured through convolutional neural net. And if we look at that area of annual inundation extent over time from these different products, so if we look at the global flood database, which I talked about earlier, in this blue line, blue dashed line here, we have really low, sort of annual low amounts of inundation in Bangladesh, whereas this red line, which is this sort of this deep learning model, that fusion model, right, has a higher level of prediction in terms of inundation. So from this, we sort of infer that the global flood database tends to be really, really conservative in terms of how we estimate surface water and inundation, which makes total sense, right? We can't really see through clouds, and so in those periods of time, we're not really saying where surface water exists. This deep learning fusion model has really the capability of using information in past time steps to help it make predictions in a current time step, even if there is cloud cover. Okay. So this is an improved model. I think I kept saying we, but I actually wasn't involved in that paper. This is Jonathan Giesendanner, who worked with Beth Tellman to make this data for Bangladesh. And at the time, we were working with public health researchers and found this to be a really exciting data set to ask some questions for public health outcomes in Bangladesh. A little more on why, just some more insight on how this is an improvement over the global flood database. So Alex Saunders is a PhD student at the University of Arizona, where I came from. He also works with Beth Tellman. And they took a number of satellite-based flood products, including the global flood database here in the bottom in red, and the deep learning model here, highlighted in red here. And basically what this shows is anywhere that you see red means that this global flood database product is underestimating inundated area compared to other models. So compared to this model from Thomas, which is a Sentinel-1 model, this one, which is also a Sentinel-1 model, another Sentinel-1 model, then this deep learning product, right? So global flood database is underestimating across all of these products. So consistently we can say we're probably not representing floods very well with the global flood database. And if we just do sort of simple linear regressions and R-squareds, we can see that the global flood database is explaining very low amounts of variation in these other data sets, R-squareds of 0.1, between 0.1 and 0.2. Okay. Whereas this fusion model, okay, right, we're getting R-squareds 0.6, 0.74, 0.76 with these other Sentinel-1 products, right, which can see through clouds, which are higher resolution at 10 meters. So it's a really strong indication that this deep learning model is capturing inundation and flooding more appropriately. Okay. So, and I'll say one last thing. And so one interesting thing that we, as a virtue of using those methods, is that we can actually get weekly inundation extents. Because we actually do so well on sort of single images, we can extract surface water across Bangladesh for any given week. So this little animation that you see changing through time is a representation of surface water extended in Bangladesh for every week. Okay. So we took this data for Bangladesh and wanted to look at how is that affecting infant mortality across the whole country. And so we took a really useful data set to look at health outcomes, particularly in low and middle income countries, called the Demographic Health Surveys. And this household survey has a really interesting feature to it where you ask a family, a mother, the children that she's had, the years that they were born, and their health status as of those years. And so you actually get a panel data set on this of infants through time. So if there was a flood in 2025 or 2020 or 2017, we have a population of children and infants that we can understand how floods impacted them. And then by virtue of, so this map here on the left shows all of those different household surveys across Bangladesh. Every little dot is a household. And by virtue of the data that we made using the deep learning method, we can actually represent, we have weekly information, and so we can draw out these interesting intensity measures in terms of the severity of floods. So areas that have frequently experienced many floods in Bangladesh. Okay? So higher blues represent sort of higher intensity and frequency of flooding, where these orange and yellow colors represent lower frequency and intensity. And interestingly, the study that we worked on here on the right is in contrast to previous work that was also done in Bangladesh using the Global Flood Database. And there, they could only really compare households that were in flood risk areas. Okay? So that's in blue, and areas that were not in flood risk areas. So that's in yellow. Okay? So they're really looking at a cross-section of houses, of households sort of between these two designations. If you do work on causal inference and you hear the word cross-section, to you that's a less powerful estimate of the outcomes that you're interested in. And so what we found from this study is that mortality does increase as a result of flood intensity. So here we have the different percentiles of flood intensity. But it's a reason that it leads to higher rates of infant mortality it actually occurs in utero. Okay, so here, the exposure window of in utero in red versus blue, the first year of life. And so this is actually a huge problem and a huge challenge for pregnant women. And one way in which climate disasters and flooding is a gendered problem. Okay, but we find that infant mortality risk is increasing somewhere around 16 to 36%, depending on the flood intensity. Okay, and in the whole sort of period that we look at, we found that there's something like 7,000 excess infant deaths per year, which is just a striking number to me. And if we compare that to this study that I was talking about before, we're actually finding 45% higher rates as a result of using this different data and this different method. Some of the advantages of this method are that we can really sort of control for household characteristics and changing characteristics of mortality over time. So we're essentially using a panel of fixed effects in terms of household units and year. So that's how we extended some of our work into Bangladesh. Some of the work that we've done on using deep learning methods to then also drive some of these public health questions. And some of the directions that I'm taking here at the University of Wisconsin, I will talk about them through what some of the students that I work with and what they're doing. So Prashanti Sharma, Prashanti's back here. So she's doing similar research to what I've just talked about in Bangladesh, but in India. So using the demographic health survey there, which is, in comparison to Bangladesh, is a massive survey. I think there's millions of households in terms of surveys in India. Making a similar flood exposure data set for India using similar methods as I talked about before, and asking questions of what are the results on infant mortality in India. Prashanti is visiting here from the University of Arizona, our prior institution, and so she's here for the semester. And if anyone's interested in that work, I'd encourage you to talk to her. I have a master's student who we're trying to improve some of the ways that we estimate flooding. All of the methods that I've talked about here are based on a satellite called MODIS. That's a very coarse satellite at 500 to 250 meters. Okay, so a quarter to a half kilometer in terms of the spatial resolution. We're seeing if we can use a product called Harmonized Landsat Sentinel-2, which is at 30 meters. The downside is you only get an image every 2 or 3 days as opposed to MODIS where you get 2 a day. So how well can that do in terms of the temporal and spatial estimation of flooding using that product? We're using some hand labels from a published data set that represents flooding, making a prediction using deep learning models. If you're interested in deep learning models, I teach a class on AI and remote sensing, 2:30 after this lecture. And then we make predictions of flooding with that. So my master's student, Brooke Cox, she's working on that. Another student who's still at the University of Arizona but works with both Beth and I, Alex Saunders. He's doing really interesting work on how do we understand some of the induced agricultural losses to flooding in the United States. I'm really interested in this method because he's looking at how can we use flood insurance data that covers farmers in the United States through a USDA program, which has really high rates of subscription in the Midwest in particular. I think about 95% of farmers enroll in this insurance program. And so using that insurance claim payout data, we can use some of these flood maps to understand how well are we estimating damage in those agricultural regions. Super excited about this because this is potentially a remote sensing methodology that we could take to some data poor regions where flooding and agricultural vulnerability is a really big problem. So to wrap up, we sort of started looking about talking about Hurricane Maria in terms of some of the health outcomes that are occurring after climate disasters. Right? We used to have estimates that the official death toll in Hurricane Maria was 64, using some of the methods that I just talked about here, but below for a single event. Right? There's other estimates that are upwards of 4,000 and 5,000 deaths. This is a really important area for us, not to just account for the human toll of climate disasters, but to really make statements about what is happening in terms of our vulnerability over time, adaptation over time. This is a key way that we understand how we're evolving with climate change. And I think satellite imagery is a really compelling way to start to understand, in particular for flooding, what are some of the historical patterns that we see in terms of public health outcomes. I'm also interested in other societal outcomes like agriculture, for example. And that's some of the research that I'll be doing here at the University of Wisconsin. That's it. Thank you.
All right, well, thank you.